Welcome to Healthy Lifestyle Tips, where we're always striving to bring you the latest insights into how you can live a healthier, happier life. In today's video, we're going to explore an often overlooked but critical component of our health: bone marrow. Bone marrow is one of the most essential parts of our bodies that keeps us alive. Bone marrow is a soft, spongy tissue found inside our bones that produces blood cells. It's responsible for producing red blood cells, white blood cells, and platelets, all of which are essential for our survival. Let's take a closer look at how bone marrow keeps us alive. Red blood cells. Red blood cells, or erythrocytes, are responsible for carrying oxygen from the lungs to the rest of the body. They also help to remove carbon dioxide, a waste product, from the body. Without red blood cells, we would not be able to transport oxygen to our organs, which would lead to organ failure and ultimately death. When we think about the importance of oxygen in our body, we might initially think about the lungs as the primary organ responsible for supplying oxygen to our cells. However, the role of red blood cells should not be underestimated. Red blood cells contain a protein called hemoglobin, which binds to oxygen and carries it throughout the body. This oxygen is then released to the cells that need it, allowing them to perform their necessary functions. Now, imagine for a moment that your body suddenly stops producing red blood cells. You might not notice any immediate effects, but over time, you would begin to feel the consequences of this lack of oxygen supply. You might become fatigued, short of breath, or dizzy. Eventually, if left untreated, this lack of oxygen supply could lead to organ failure and even death. This is where bone marrow comes in. The bone marrow produces approximately 2.6 million red blood cells every second. This incredible rate of production ensures that our body has a constant supply of fresh, oxygen-carrying red blood cells. But why is this constant supply of fresh red blood cells so essential? Red blood cells have a lifespan of around 120 days, after which they are broken down and recycled by the body. This means that our body needs to continually produce new red blood cells to replace the old ones. If for any reason, our body is not producing enough red blood cells to replace those that have reached the end of their lifespan, we could develop a condition called anemia. Anemia is characterized by a lack of red blood cells, which leads to a decreased ability to carry oxygen throughout the body. White blood cells. White blood cells, or leukocytes, are an essential part of our immune system. They protect us from infection by identifying and attacking foreign invaders such as bacteria and viruses. Bone marrow produces a range of different types of white blood cells, each with a specific function in the immune system. For example, neutrophils are the most abundant type of white blood cell and are responsible for killing bacteria. Lymphocytes, on the other hand, are responsible for recognizing and attacking specific viruses and cancer cells. Without white blood cells, our immune system would be severely compromised, and we would be vulnerable to a wide range of infections and illnesses. Platelets. Platelets are tiny cells in our blood that play a vital role in stopping bleeding. When we get a cut or injury that causes bleeding, platelets rush to the site of the injury and form a clot, which stops the bleeding. Without platelets, even a small cut could lead to excessive bleeding, which could be life-threatening in severe cases. Bone marrow is responsible for producing platelets. Platelets are actually small fragments of cells that are produced when large cells in the bone marrow, called megakaryocytes, break apart. These fragments are then released into the bloodstream, where they circulate until they are needed to form a clot. Platelet production is a constant process, with bone marrow producing around 400 billion platelets per day. This ensures that we have a constant supply of platelets to prevent excessive bleeding. However, certain conditions, such as leukemia or chemotherapy, can cause platelet production to decrease, which can lead to a higher risk of bleeding. It's important to note that while bone marrow produces a significant amount of platelets, not all platelets are created equal. Some platelets may be more effective at forming clots than others, and platelet function can also be affected by various factors, such as medication or underlying health conditions. As you can see, bone marrow is critical for our survival. Without bone marrow, we would not be able to produce the blood cells that are necessary for maintaining a healthy body. It's vital to take care of our bone marrow by eating a healthy diet, staying hydrated, and avoiding exposure to toxins and radiation. In conclusion, bone marrow plays a crucial role in keeping us alive. It produces the red blood cells, white blood cells, and platelets that are necessary for our survival. So, take care of your bone marrow, and it will take care of you. If you enjoyed this video, please subscribe to our channel, Healthy Lifestyle Tips, for more informative and engaging content on how to live a healthy lifestyle.